This is a global health perspective on drug abuse and drug use in Vietnam. So I'm going to start by providing some background about the culture of Vietnam, and then some habits and addictions, some risk factors, and then the connection between substance abuse and health illness. And then at the end, I'll provide some solutions to the issues that I find to be effective. So we're going to start with the culture of Vietnam, which is very strong and arguably one of the strongest in Southeast Asia. Now I'm going to start at the Socialist Republic of Vietnam, which was formed post-Vietnam War, and wrote in their 1992 constitution that drug use is very dangerous and is a dangerous social disease and a social evil. This is important to note because it provides us information on the view from the government on drug use and addiction. Now, the country has a very strong history of opioid abuse due to this location, which is near the Golden Triangle. The Golden Triangle is an area of land which is very famous for its opioid production because of its ability to grow poppies at such a strong rate. Now, you would think that as a country with such a long history of drug use and abuse, Vietnam would have a more effective way of addressing the issue. However, the negative attitude towards the idea of drug abuse has created a stigmatized cloud that kind of just keeps everyone away from even addressing the problem. Now, this doesn't stop the overall use of alcohol, as the access to alcohol is very cheap and easy. So we're gonna move on to the habits and addiction. Throughout Vietnamese culture, drinking is very normal and expected, especially when there's celebrations like birthdays and weddings going on, and even national holidays. This, in addition to the fact that alcohol usage and intoxication is very normalized behavior, even in the normal day-to-day life, and especially in those of the young male population, means that there's higher risk of alcohol addiction and alcohol abuse. This is also in addition to the country's macroeconomic growth, which has also led to a rise in alcohol consumption and addiction. This, along with other addictive habits like gambling and internet usage, are also a problem, as they tend to motivate each other and create more addiction. Now, some risk factors. So macroeconomic growth in low to middle income countries has always been correlated with an increase in alcohol consumption. This is an issue because, as of recent, Vietnam's economic growth has spiked, and that means the alcohol consumption has also spiked. Now, this is an issue we'll have to address later. Another major issue is the home production of alcohol, which is very popular in Vietnam. It's one of its largest risk factors because there's no regulation of alcohol production at home, so we're unable to regulate how much alcohol and what kind of alcohol they're producing at home. Now, another one of the biggest disparities in Vietnam is gender, as males are much more likely to consume and abuse alcohol. Now, I'm going to move on to some connections between the substance abuse and health illness. So, substance abuse has a twin illness in Vietnam, and what I mean by this is that there's two epidemics going on, which is the HIV epidemic and the UID epidemic. IDU. Now, IDU stands for injection drug users, and this is unfortunate because it's estimated that 26% of IDU users are also HIV positive. This is likely due to sharing needles and probably soberness, as those who are using drugs are more likely to become HIV positive. Now, according to a study in 2016, Vietnam had about 21,000 drug-related deaths, which is about 36 per million, which is one of the highest in this region. Now, I want to provide some solutions to the problems I mentioned. So by creating awareness campaigns that educate the public on physical and mental health abuse, we can kind of just erase this stigma, this cloud around the entire idea that it's such a negative thing, and kind of normalize it. And then another solution we can create is creating school-based education programs that attack the issue as in the youth, and kind of educate them when they're younger so they don't grow up with this idea that it'll be okay. Another solution I can provide is implementing policies and restrictions that'll make alcohol harder for the youth to access. Now, this is just as a support system to these education programs that I'm mentioning, as as we educate the youth, they might be motivated to try alcohol at some time in their life. Now, another solution I wanted to mention was training our healthcare professionals to enhance their abilities to identify and address substance abuse. Now, providing the support is very important because many are unwilling or unlikely to seek assistance. So, us being more welcoming and knowing more about the entire issue at hand will allow for an easier solution to those seeking assistance. Now, this, in addition to increasing the accessibility to the treatment overall, would make access to treatments a lot easier for those who are actually seeking help. And yeah, that's my overview on drug use and drug abuse in Vietnam. Thank you so much.